My name is Dr. Zwelling, and welcome to our pharmaceutical library. I'd like to talk to you today about pain and options for pain. There are many, many, many pain medications. Let's start by talking about the various categories of pain medicines. First, we have the anti-inflammatories. Aspirin is actually a pain medication, and sometimes it can be satisfactory. A couple of aspirin can take away a headache, certainly, and they can take away joint pain. Other anti-inflammatory medicines, non-steroidal anti-inflammatory drugs known as NSAID or NSAIDs, there's a slew of them. Lodine, Mobic, Celebrex. Celebrex gets a lot of celebrity because it tends to not disturb the stomach quite as much. We'll talk about that in a moment. But as a reliever of pain, it depends upon what works for you. In general, the best drug of all the anti-inflammatories, if you have any cardiac problems, seems to be naproxen, otherwise known as naproxen or Aleve. Aleve tends to be a little longer acting than the usual ibuprofen. You can take 2 Aleve in the morning and 2 Aleve in the evening over the counter and get a lot of relief. It seems to be the most heart-happy of all of the pain medications that fall into the anti-inflammatory class. But most importantly, use the one that works for you. The complications of these medicines, though, really, the list is long. First of all, they can bother your stomach, so be careful and take them with food. Advil, aspirin, Aleve, usually taken better with food, as are the rest of the medications. Celebrex, again, has less problems with your stomach, but if it doesn't work, it doesn't matter if it doesn't hurt your stomach. Find the one first that works for you and find the way that it works best for you. Now, when we're talking about pain, I have to mention the opiates. Opiates have a lot of favor, in particular with orthopedists, because of their pain relief after operations. But they are awful drugs. Older people should, I think, never take an opiate. They disturb your mental status. People fall. They really, your judgment is bad. Opiates are made to be used post-operatively or when the pain is intense, when you're in bed and you're not going to get up and go running around. They are not to be used when you're driving. They're not to be used when you're out walking alone, particularly if you're older. I find it really a disaster when my older patients go to an emergency room and they've sprained their ankle, for instance, and a doctor will send them home on an opiate. I find that to be very dangerous. They are also quite constipating, and in fact they can decrease your urination as well. So for an older person who's already constipated and can't urinate, oh my gosh, what a problem. So if you're in a horrible, horrible, horrible amount of pain and the anti-inflammatories aren't working, by all means talk to your doctor. There is a drug called Ultram or Tramadol, and that medication has some opiate-like effects without being changing your mental status. So Ultram may be an alternative for you. Sometimes it causes some nausea. In general, please think about using anti-inflammatory medications as the first line. Most pain is caused from inflammation. So obviously, if you want to get to the root of the pain, you want to take an anti-inflammatory because that will get rid of the inflammation. If you sprained your ankle, elevate, ice, and apply and use some pain medication, the anti-inflammatory. Be very careful with the opiates. Only use them under a doctor's supervision. And don't keep an extra supply at home. You never know when children might get into them, or even an unknowing adult, and they can be very dangerous. Hopefully that will help, but if you have any questions, you know you can always call your doctor.